Hi, I'm Ken Cutbush. I'd like to talk to you about the potential risks that you need to consider if you're going to have an arthroscopic acromioplasty. An arthroscopic acromioplasty involves shaving a little bit of this bone here off to give your rotator cuff some more room. This is an MRI scan of a patient with rotator cuff tendonitis. It looks at the shoulder fronton. This is to the top of the humerus, and you can see the ball of the shoulder joint here. The black line is bone. Over that is a little layer of grey, which is the cartilage layer. The white is fluid. And you can see the socket here. This is the shoulder blade or scapula. The acromion is part of that. So this is acromion. That's the AC joint. This is the clavicle or collarbone. You can see the outline of the skin. This is the deltoid muscle here. Now the rotator cuff, this is the supraspinatus muscle. It's part of the rotator cuff on the top of the shoulder. And you can see the tendon forming within it. And then this here is tendon coming across between the acromion and the top of the humeral head, comes across the top of the cartilage, and it joins onto this ledge of bone over here at the tuberosity. Between the top of the rotator cuff and the undersurface of the deltoid, you see that streak of white. That white is fluid in the bursa, and that's consistent with bursitis with this patient. And this rotator cuff here is unhappy. It should be nice and dark in a normal tendon, but this is bright, which means it's inflamed and unhappy. Now, in impingement, which is what we're talking about, what happens, this area of rotator cuff here, when you lift your arm up to the side, it has to swing underneath this ledge, the acromion, and there's a little spur here, you can see that there, and it catches on that point. So people will get pain when they lift up their arm, usually at about this level, about shoulder height or 90 degrees of abduction. And what we do with the arthroscopic acromioplasty is go in with keyhole surgery with a little burr, and we burr off the undersurface of the acromion. What we want to do is take that spur off, take the undersurface of the acromion off to give you more room so that when you lift your shoulder up, there's more room for your rotator cuff to swing underneath this ledge of bone so you don't catch and you don't get that pain when you lift your arm up. Now, what I say to patients is probably the biggest risk is frozen shoulder. A certain percentage of patients get frozen shoulder. That will resolve given enough time, but it can be miserable until it does. We can't predict it and we can't stop it from happening. Infection's really rare with an arthroscopic acromioplasty, much less than 1%. You have the risk of the anesthetic as well. It's, for me, a general anesthetic, and any anesthetic has a risk associated with it. Now, if we look at this paper, this was a scientific publication by Spiegel et al. In the Journal of Shoulder and Elbow Surgery in 2002. They're actually looking at open versus arthroscopic acromioplasties back in the day when we were doing the changeover towards from open to arthroscopic acromioplasties. These days, almost all operations will be arthroscopic in terms of the acromioplasty. If you'd like to actually look at the reference itself, if you scan that QR code, it will take you directly to the publication. What they found with their group of patients was there was a 7% complication rate, and if you break that down, frozen shoulder was the commonest complication, running around 3%. About 1% of patients got an infection. I think that's high. That's for an arthroscopic acromioplasty, it's more like 1 in a few hundred. Instability was also seen. About 5% of patients reported feeling a sense of instability or subluxation of the shoulder after the acromioplasty. I think we might consider some of those patients actually had that problem before the operation, and that should have been addressed rather than having an acromioplasty. But that's another topic. So that gives a rundown of the potential complications, the risks that you need to consider when thinking about having an arthroscopic acromioplasty. Thank you for listening.